Good day everyone, I'm Andrea J.D. Sabino, your student's nurse. And for today, I'll be performing a return demonstration on the assessment of the head, neck, eyes, ears, nose, mouth, and throat. So you want to perform on this procedure, you want to perform a proper hand hygiene and put on PPE if indicated. And after this, we can now proceed in the assessment. Good day, ma'am. I'm Andrea J.D. Sabino, your student's nurse for today. So, for verification, ma'am, may I know your name po?
Johanna Besario po.
Okay. How about your birthday, ma'am?
July 2, 2005.
Okay. How old are you po?
16.
So, that is the first one. We have to identify our patient in order to ensure that we have the correct patient in front of us. If there's any curtains or any doors in their room, you want to close as well in order to provide privacy. After that, you can now explain the purpose of the assessment to the client. So, what do you want me to call you po, ma'am?
Hannah.
Okay, Ma'am Hannah, I'm here in order to perform an assessment on your head, neck, and the facial features in order to ensure that everything is normal. If there's abnormalities, you are going to take note of that, okay? So, Ma'am Hannah, how are you po pala?
I'm okay.
Have you noticed any changes on your face, head, and on your neck?
Nothing.
But before we start, do you have any concern or question for me before we begin?
Nothing.
So now we can now proceed to the first part of the assessment, which is inspections. So that is the first we wanted to inspect here. We wanted to inspect the head and the face for any signs of discoloration, any signs of disformity, or unequal distribution of facial hair. So, I'm inspecting the face and the neck of the client. It seems that the color of the skin is normal. The facial features are also symmetrical. There are no signs of skin lesion as well, and there are no signs of assessment of hair muscles. Okay, that's everything is normal. Okay, ma'am, kindly raise your eyebrows for me. Kindly smile for me. So, if you notice any drooping of the face, we indicated stroke, false palsy. So, you want to take note of that, okay? Just wait for a few seconds, ma'am. Put my hands on your head. That will be okay with you, ma'am.
Okay.
So, the next thing you will do is to palpate the skull of the client. In order to feel any signs of lumps, any signs of bumps. Okay, good. Lastly, we inspect the overall skin coloration of the client for any signs of jaundice, cyanosis, or pallor. But I'm expecting everything seems normal, so that will be okay. So, we can now proceed in the assessment of the neck. For head of our client, going to the posterior cervical lymph nodes. Going to touch your face, that will be okay with you, ma'am. We're going this in slow and circular motions. From the forehead, going to the posterior triangle. Trying to assess any tenderness. Do you feel any pain?
No.
Let me palpate in front and behind your ears in circular motion. The under the chin. To anterior triangle of your neck. So after that, we want to palpate the left and the right carotid arteries one at a time. Same motion. We're trying to look here any swelling, tenderness. Also, we inspect the thyroid glands. have a posterior and anterior. The anterior and the posterior. Next, we inspect and palpate is the supraclavicular area of our client. Kindly raise your shoulder for me. It's located here. Do you feel any pain or discomfort?
Not at all.
Okay. So that we can invite our client the size of the movement of her neck. May I invite you to touch your chest using your chin? Your shoulder using your chin? Kindly touch your shoulder using your ears. Do you feel any pain or discomfort?
No.
Okay. Can you move your head like this? Do you feel any pain or discomfort?
No.
Okay. So now let us proceed to the inspection of the eyes. So the first that you want to inspect is the external eye structure. So before that, you want to ask our client some questions. So Ma'am Hannah, have you had trouble with your eyesight pupils?
No.
Any allergy or surgery?
No.
Any allergies?
No.
Any pain or discomfort?
No.
That's good to hear. Okay, ma'am. So I will be inspecting your external eye structure. Includes your eyebrows, eyelids, and eyelashes, okay? So I'm inspecting the external eye structure of my clients. The eyelid seems normal. There is no signs of swelling. The skin condition and the iris also cover the top quarter of the iris, which is normal. There are no signs of thinning of the eyelashes, which is good as well. So now we can now proceed to the inspecting of the cornea, conjunctiva, and also the sclera. So I'm inspecting the cornea of our client. We want to have the test for corneal reflex. In order to do that, we need to prepare our light. So what I'm trying to look for here is the spot where the light is being reflected. If the light is reflected at the same spot, but if the light is non-reflected at the same spot, that will be abnormal. So that already is strabismus. So they're both constricted and equal size. We want to take note of that, okay? The next thing that we want to inspect is the conjunctiva and the sclera of our client. So sclera, you want to take note of the color of the sclera, because if the sclera is turns to yellowish, that will be already indicated jaundice. Jaundice indicated hepatitis. So you want to take note of that, okay? To prevent further complications, we also wanted to take note of any swelling, especially on the conjunctiva because indicated chemosis. So you want to take note of that, okay? Now we want to take a left of the bulbar conjunctiva of our client. We want to invite our client to look up and pull the lower eye downward. Invite to look down, as well to pull the eyelids upward. The bulbar conjunctiva is okay. Now let us perform the cover and uncover test. Why do we perform the cover and uncover test? To ensure the alignment of the eye of our client is all normal. If the client any signs of exophoria or esophoria. Okay, there are no signs of exophoria and esophoria. So now let us proceed to the examining of the pupil of our client. So on examining pupils or conducting complete pupils assessment, we need to use Prelapatrick. So the pupil should be equal, round, reactive, light reaction, and accommodation. So let us see. Look at me for a while. So I'm expecting the pupil of my client is equal, round. So now let us see if reactive or non-reactive. I want to turn off the light. And seeing the pen light both of the eyes of our client. Okay, both seems reacting and not reacting. Afterwards, we can now proceed to the testing of the pupillary convergence and accommodation reflex of the pupil of our client. So, what is the pupillary convergence? That is ability of the eyes move inward, get closer to the face, and accommodation reflex is the ability of the eyes to pulpate the visual attention of the object nearing to the face. We want to move this pencil towards to the face of our client. So, after conducting a complete pupil assessment, trying to look for here. We're gonna trying to look for any signs of cataract. So now we can now proceed to assess the visual acuity, smell, and chart. Kindly read the letter that you can for me, starting to the smaller to the bigger. So kindly cover your left eye for me. Okay. Try to this to the right side. Okay, that's good. It seems like my eyesight of my client is already good and nice. So now we can now proceed to the assessing of 6 cardinal fits grades of our client. Please follow the pencil. Okay, good. So, after the assessment of the eyes, we can now proceed to the assessment of the ear. So, the first we inspect here is the external ear structures of our client. For any signs of redness, inflammation, or swelling, we want to palpate the ears going down. We also to take note of the color. So now we want to palpate your external ear going to the mastoid. That will be okay with you? I'm going to touch your face, ma'am. That will be okay with you, ma'am. We're trying to assess any swelling, tenderness as well, or any pain. Do you feel any pain, ma'am? So the next thing that we need to do is to inspect the external ear of our client using this otoscope. So we need to pull upward, backward, and let's see. So what I'm trying to look for here, I'm trying to look for any signs of earwax that obstruct our ear canal. It seems everything is normal. So last thing that we need to do is to the assessment of the ears. Perform whisper test to assess hearings. Seems like hearing my client is good. If not, we can now perform the Weber if there's trouble in hearing. So after the assessment of the ears, we can now proceed to the assessment of the nose. The next we inspect is the external nose structure of our client. And also I'm inspecting the color is normal. No signs of skin lesions. So the next one we can do is to palpate the nose. The external part of the nose going to the frontal and maxillary noses. So I'm going to touch your face, ma'am. That will be okay with you?
Yes.
So what we are trying to feel here? We're trying to feel any signs of tenderness, any signs of replacement of the bones, Do you feel any pain, ma'am?
No.
Going to the frontal sinuses. Going to maxillary sinuses. There are no tenderness at all. No swelling. Okay. The next thing that we want to do is to occlude one nostril externally. So, I'm going to cover this part of your nose. That will be okay with you, ma'am.
Yes.
Inhale. Exhale. Did you feel any trouble with breathing?
No.
Okay, other side. Inhale. Exhale. Did you feel any trouble with breathing?
No.
Okay, good to hear. So after that, we can now proceed to the inspecting. Kindly head up. Any redness? Any abnormalities with the nose? With inspecting, there are no signs of nose. Everything is normal. And lastly, do you smell the scent?
Vanilla.
Okay, great. After the assessment of the nose, we can now proceed to the assessment of the mouth. What we inspect here is the temporomandibular joint of our client. Just locate it here. Please open your mouth for me. Close it. Okay. We also inspect the lips, the oral mucosa, the hard and the soft plates, the gingiva, the teeth, and the salivary glands of our client. And we do this having pen light and tongue depressors. For a while, kindly open your mouth for me, ma'am. So we are trying to look for here any kind of swelling or inflammation. No oral mucosa. Everything is normal, that's good. The next thing that we want to do here is to inspect the tongue of our client. Okay, that's all normal. So, I'm going to put on this in your tongue. That will be okay with you, ma'am?
Yes.
Ah. Left. Right. Okay. So, the last thing we inspect here is the uvula and palpate the tongue of our client. Kindly, Okay, let's see. So, what we are trying to look here, we're trying to look any signs of swelling for uvula. Assess or we inspect the mouth of our client. Also, the tenderness. As we do that, we want to palpate the tongue of our client. Okay, Something to taste with you, ma'am. That will be okay with you.
Yes.
Okay. What do you taste, ma'am?
It's salty.
What do you taste, ma'am?
Sweet.
Okay, ma'am. That's all. It's not. Now, let us proceed in the assessment of the throat. So, I will use the tongue depressor and the pen light to inspect my client throat. Can you open your mouth for me? Okay, I didn't see any problems. Your tonsil is good as well. There are no damage as well. After that, we now done in the assessment of the head, neck, eyes, ears, nose, mouth, and throat. Lastly, we had to remove our PPE and perform a proper hand hygiene. And document the procedure that we have performed and refer to further evaluations. And after that, we now done in the assessment. Thank you.